Most men don't realize this, but the body keeps score when intimacy disappears. I'm Dr. Sara, and if you've gone months or years without sex, your hormones, your mind, and even your confidence may already be changing silently. What I'm about to explain could completely shift how you understand your energy, your desire, and your health as a man. When a man goes for a long time without sex, one of the first systems quietly affected is his hormonal balance, especially testosterone, which is the core fuel behind male vitality. Testosterone is not only about sexual desire, it drives physical strength, muscle maintenance, bone density, motivation, mental sharpness, and emotional stability. Sexual activity and arousal naturally stimulate testosterone production and help keep this hormone within a healthy rhythm. When sexual stimulation is absent for an extended period, some men may notice subtle but real changes, such as lower energy levels, reduced drive, slower recovery from physical effort, and a general feeling of mental dullness. Over time, this can affect how a man shows up in daily life, from work performance to personal discipline. Many men mistakenly believe testosterone only matters in the gym or bedroom, but in reality it influences how confident, assertive, and focused a man feels throughout the day. Without regular hormonal signaling triggered by intimacy and release, the body may shift toward a less active hormonal state, especially when combined with stress, poor sleep, or aging. This can lead to irritability, mood swings, or a feeling of emotional flatness, when motivation drops and small challenges feel heavier than they should. In some cases, prolonged sexual inactivity can also reduce sensitivity to arousal, making it harder for the body to respond strongly when sexual opportunities return, which further reinforces hormonal sluggishness. The brain and endocrine system work together, and sexual expression is one of the natural feedback loops that keep this system alert and responsive. When that loop is inactive for too long, the body adapts by lowering expectations, and hormones follow that pattern. This does not mean that a man is broken or unhealthy simply because he is not having sex, but it does mean that sexual health is deeply connected to overall male vitality. Men who neglect this aspect of their biology often compensate with caffeine, sugar, or constant stimulation, yet still feel tired or unmotivated. Restoring hormonal balance does not depend on reckless behavior, but on understanding that intimacy, physical attraction, emotional connection, exercise, quality sleep, and purpose all work together to support testosterone. When a man respects his sexual health as part of his total well-being, his hormones respond by supporting strength, clarity, and inner drive, reminding him that masculinity is not just an idea, but a biological rhythm that needs care and attention to stay strong. When a man goes without sex for a long period of time, the effects are often felt first in his mental and emotional state, even before any physical changes become obvious. Sexual activity naturally triggers the release of powerful neurochemicals such as dopamine, oxytocin, serotonin, and endorphins, all of which play a critical role in regulating mood, stress, and emotional connection. These chemicals help the brain relax, reduce cortisol levels, and create a sense of emotional safety and satisfaction. When sex and intimacy are missing for a long time, the brain may remain in a more alert, stressed, or restless state, making it harder to unwind mentally. Many men begin to experience increased irritability, mental tension, or persistent feeling of dissatisfaction without clearly understanding why. Stress that would normally be released through intimacy can start to accumulate, affecting focus, patience, and emotional control. Sleep quality may also decline as sexual release helps the nervous system shift into a calmer mode that supports deeper rest. Without this natural calming mechanism, the mind may stay overactive at night, leading to shallow sleep or frequent waking. Over time, this lack of emotional release can contribute to anxiety, low mood, or a sense of emotional numbness. Men are often conditioned to suppress emotions, and when physical intimacy is removed, they lose one of the few socially acceptable outlets for emotional connection and vulnerability. This can result in feelings of isolation, even when surrounded by people. Confidence may slowly erode, not because of weakness, but because intimacy reinforces a man's sense of being desired, valued, and connected. Without it, self-doubt can creep in, making social interactions feel more draining or less rewarding. The brain begins to associate closeness with frustration instead of comfort, which can further reduce motivation to seek connection. Chronic mental stress caused by prolonged sexual deprivation can also spill into other areas of life. Increased reliance on unhealthy coping mechanisms such as excessive screen time, overeating, or constant distraction. While abstinence itself is not harmful, ignoring the psychological need for intimacy and emotional release can quietly strain mental health. When men recognize that sexual well-being is closely tied to emotional balance, they are better able to manage stress, protect their mental clarity, and maintain a stable, grounded sense of self even during challenging phases of life. When a man goes for a long time without sexual activity or ejaculation, subtle changes can begin to occur in circulation and prostate function, even though they may not be immediately noticeable. Sexual arousal increases blood flow throughout the body, especially to the pelvic region, supporting the health of blood vessels, nerves, and reproductive organs. Erections themselves are a vascular event requiring strong circulation and responsive blood vessels, and regular arousal helps keep this system active and flexible. When sexual stimulation is absent for long periods, the pelvic blood flow may become less efficient, particularly in men who are already sedentary or under chronic stress. Over time, this can contribute to a feeling of pelvic heaviness, tightness, or reduced sensitivity. Ejaculation also plays a role in prostate health by helping to clear prostatic fluid, which supports normal gland function. Long gaps between ejaculations may allow prostatic secretions to build up, increasing pressure within the gland and potentially contributing to discomfort or inflammation in some men. While this does not automatically lead to disease, it can become a risk factor when combined with poor diet, dehydration, lack of movement, and aging. Circulation is not limited to the penis and prostate. Sexual activity supports overall vascular health by engaging the cardiovascular system in a natural rhythmic way. When this stimulation is missing, blood flow patterns can become less dynamic, which may influence erectile quality over time. Reduced blood flow responsiveness can make erections less firm or slower to develop. When sexual activity resumes, reinforcing anxiety and performance concerns, this cycle can discourage men from engaging sexually, further reducing circulation to the area. Additionally, pelvic floor muscles are activated during arousal and orgasm, and regular engagement helps maintain their strength and coordination. Without this activation, these muscles can weaken or tighten improperly, affecting urinary control, erectile strength, and comfort in the pelvic region. Prostate health is closely connected to lifestyle and sexual inactivity combined with prolonged sitting, low physical activity, and high stress can compound negative effects. Movement, hydration, and healthy sexual expression all work together to support optimal circulation and gland function. When men understand that sexual activity is not just pleasure but also a form of biological maintenance, they are more likely to prioritize habits that keep blood flowing, tissues healthy, and the prostate functioning smoothly as they age. When a man goes without sex for a long time, the impact often extends beyond the body and mind into his sense of identity, confidence, and masculine energy. Sexual desire and expression are closely tied to how men experience themselves as capable, attractive, and alive. Regular intimacy reinforces a man's awareness of his own physical presence and desirability. And when that connection is missing for an extended period, libido can gradually decline. This does not happen suddenly but slowly, as the body and brain adapt to a lower level of sexual expectation. Desire is partly use-dependent, and when it is not engaged, the nervous system may reduce its responsiveness, making arousal weaker or less urgent over time. This can create a cycle where reduced desire leads to avoidance of intimacy, which further lowers confidence and sexual interest. Many men begin to feel disconnected from their bodies, paying less attention to grooming, posture, fitness, and overall self-care, because the internal drive that fuels these behaviors becomes quieter. Confidence is not only built through success and achievement, but also through feeling wanted and capable of intimacy. When sexual validation disappears for a long time, self-doubt can slowly take its place, affecting how a man speaks, moves, and carries himself in social and professional settings. Masculine energy, which is expressed through assertiveness, presence, and grounded strength, can feel muted when sexual expression is suppressed or neglected. This does not mean masculinity is lost, but rather that it is understimulated. Men may notice they take fewer risks, avoid eye contact, or feel less motivated to pursue goals that once excited them. Emotional withdrawal can follow, as intimacy often serves as a bridge between physical desire and emotional openness. Without that bridge, men may become more closed off, less expressive, or more isolated, even if they do not consciously recognize the cause. Over time, this internal disconnection can affect relationships, creativity, and ambition. Reawakening desire and confidence does not require force or desperation, but awareness and intentional action. Physical movement, strength training, proper nutrition, and healthy exposure to attraction and connection can reignite masculine energy. When men honor their sexual nature as a vital part of who they are, confidence begins to return naturally. Desire strengthens, and a deeper sense of purpose and presence emerges in all areas of life.